Good evening, friends. Hope you all are doing truly well and are trying to stay safe. And as we are completely getting unblocked and resuming our routines and trying to battle the current pandemic very well. While having said that, we are here back with one more uh, uh, episode of our PCOS talks with our experts. And as you know, our Women's Life Center presents this to you on our TRUWELLTH platform. Before we really go on to it, I would quickly want to share a quick note and information on what TRUWELLTH is. TRUWELLTH is an integrative healthcare initiative guiding patients and healthy individuals to overcome their health concerns and manage self-help to reach the ultimate goal of holistic health and happiness. TRUWELLTH actually aims, this TRUWELLTH platform of life programs especially aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. Um, a quick note again on these live programs. These are organized for education and more information that you can get on different types of diseases and how to manage them. However, please note that every individual is different and and needs a personalized consultation. So please do not treat any of the views and experiences that have been shared here as a personalized consultation. For any recommendations that you need for your personal disease management, please feel free to reach us out on 98200483669 or visit our website www.truewords.in. You can reach us on the same number with any questions and concerns that you would like us to address during this live program, or you can type in your questions and comments into the comment box of any of the live channels that we are relaying ourselves today on, of course, Facebook, YouTube, Instagram, and four more new channels that we are on today, which are really these that you see here on Twitch, which is the Amazon channel. We are on Periscope and we are on Picato TV as well. So really looking forward to our discussion, continued discussion with Dr. Girija Wagh, who is an expert in this subject, and of course me trying to give you some useful nutrition tips. Having said that, I would like to give her introduction, which I love to do every time, is that she has 27 years, that is almost now 3 decades of experience in normal and high risk obstetrics and gynecology, IVF fertility treatment, nutrition and diet control, PCOS, procedures of fertility promoting laparoscopic and hysteroscopic surgeries. She's of course MBBS and has an MD obstetrics and gynecology from the BJ Medical College, Sassoon General Hospital in Pune. She has a diploma in advanced gynecology endoscopy from Germany. She's a fellow of the Indian College of Obstetrics and Gynecology and a fellow of the Indian College of Surgeons. She's a consultant at Cloud9 Apollo Hospitals, professor at Bharti Hospital, Pune, and she of course runs her own setup. She's been chairman of the Medical Disorders Committee at the coveted association or the conglomerate of societies, which is FOXY. And she is a staunch feminist and believes in empowering women by treating them and also by encouraging them in many ways. So having said that, today is going to be really a discussion session between her and me, and we are really looking forward to it as we have covered so many different topics in PCOS, including miscarriages, why PCOS happens, infertility, to up till sleep hygiene, So, madam, it has been such a beautiful experience. It's been like a journey with you doing more than 8 episodes. Today's is really a 9th episode we are doing together. And
Wow,
rightfully so, I think we are going to do a discussion trying to actually bring out all the important salient features that we have been discussing until now. And also so that the patients and women out there who are suffering from this difficult disorder can actually get more understanding of this disease and how they can really manage it well. So I'm going to really going to put it on to you, and if you would like to say a few words, and then I'm going to shoot a lot of questions regarding PCOS to you today.
Yeah, so today we decided, Rajashree, to be a little extempore about these things because these are my everyday challenges, and I understand that they are yours also being a nutritionist.
Yes.
For the simple reason that it's really, really on the rise, and unfortunately, we are finding that nearly about 20 to 30% of the young women are affected by this. That is one, but many times there is a lot of over diagnosis also done of this disorder because of lack of specifications. And then the tragedy is, girls label themselves as PCOD. Like they will come, we just have a younger 19, 20-year-old girl saying, from the age of 12 I am suffering from PCOD. Now that is very, very sad. How can at that time you were diagnosed with a PCOD? So there are a lot of conglomerates, and PCOD is not actually a disease nor also a syndrome. I would just like to call it as a sort of a situation which is definitely modifiable. And that is the reason why I always tell you that we must come together and move gradually towards trying to understand it in such a way that we are able to
Healthcare initiative guiding. Yeah, totally, and absolutely. We both say the same thing, that this is something which is not just going to affect the generation of these women who are from young to up till menopause, but also it is going to give them after effects of it, because of the metabolic diseases that they encounter because of it, and also they are going to carry it forward to the next generation. And when it is something which you say that it's a situation which we can, if we do right things, can easily overcome them, and earlier the better. Instead, we are actually propagating it as a disease in this and the further generations. So also, viewers, both of us are really trying to take this initiative forward so that we can actually eradicate PCOS, which can actually be done very easily if we follow. If we understand it well, and we understand it holistically, and follow the rules of the game and be disciplined about it. Having said that, I am going to, ma'am, I think we should first step really get the audience listening into it, understand what really PCOS is. I mean, there's a terminology, PCOS, PCOD, can be a little confusing for people out there. If you can explain how what really emerged first, and how has it really come to a terminology today?
See, actually, PCOD, you are saying so because probably you are also a scientist, more of a medical person. But girls coming to me many times call it as PCOS, and then I wonder what is this PCOS condition. So they just spell the mnemonic like that. Now, as the long form of this small mnemonic goes, it is called as polycystic ovarian syndrome or a disease. And as I mentioned, I don't like to call it a disease. Now, why is it poly means many? Cis means the ovary is studded with cis, and this is the sonographic picture that we typically see. Long time back, nearly about in the last century, there was one Sten Leventhal karke, a very famous gynecologist, and he found out that women who were fat, obese, had a lot of pigmentation, androgenism, and he typically found that they were unable to get babies, and therefore he decided to do a surgery on that. That time laparoscopy was not there. So for those large ovaries, and he realized that those large ovaries were studded with lot of big cysts, and whenever he did a wedge and reduced those, then these women used to conceive. So therefore it is used to be also called as the Steen-Leventhal syndrome. But today a lot of understanding has come into being with the sonography, the advances in understanding the metabolic abnormalities, and therefore today we are in a better position to understand and not do such kind of things like going in and opening a patient and finding out. And what we now conclude in the today's condition is it is definitely a lifestyle disorder influenced by many external factors, and there are definitely strong internal factors. And therefore, if I talk of a PCOS in America, And if I look at the PCOS as an Asian ethnicity, there is a difference between these two things, and therefore the approach, and within individuals, now we have been exchanging so many patients with each other, Rajashree, you'll realize that within the patients also, within the ethnicity also, there are various variations, and therefore we have to understand. So this ovary gets studded with unruptured eggs, because ovary is supposed to make eggs, and these eggs do not grow to the time when they'll become mature enough to be able to rupture, and therefore they just sit in the ovary and make the ovary swollen up, and that is what is called as polycystic ovarian syndrome. As I mentioned in one of our talks, I feel we should also change the name of this disorder,
Which I totally agree, especially when it has got connotated as PCOS.
Targeting the woman's ovary, it's targeting the woman's ovary.
Yeah, I think it's like you said, it's really a very much lifestyle thing, and we have to understand it. That it's needs a lifestyle approach. I mean, I get asked this common question all the time: that is nutrition really important in PCOS? So even after all this, it's really people treat it as some sort of a disease which they are not going to overcome ever. And then some of them who understand that, if they understand, okay, nutrition is important, then they'll say, oh really, can I will I see light at the end of the tunnel someday? I mean, am I really going to get well? And this is my typical answer really to them all the time. It's like, you have to understand that we are two things. I mean, one is genotype and phenotype. This is though very scientific but very simple. We all understand our genes, and phenotype is something which we are, in our holistic self. So how do we really come up? It's our genes plus our environment and our nutrition. And our environment, we know right now we have nuclear families, we keep working outside, so our lifestyle has completely changed. We are getting exposed to so much of pollution which everyone is talking about, and we all know that our environment is not taken care of, and that's really affecting us indirectly, which we don't realize. So these two parameters, and the third most parameter is nutrition. So it's really, genes is something which we can't change, we are born with, but environment and nutrition is something which we are imbibing. If these two things we are able to altercate, and nutrition is the only really thing which is in our hands. Environment is not something which is completely under our control, but nutrition is something if we can change, and also in terms of environment, if we can make changes, a lot can actually be changed. And I think weight loss, hormonal balance, inflammation, which we keep talking about, and I keep talking about oxidation, which is the free radicals which occur majorly because of pollution and wrong eating habits, junk food, etc., gives rise to it. So if all this is taken care of as an individual, so much change can really happen. And why can't PCOS be eradicated? Madam, you have so many examples that you've proven through managing lifestyles, and you've actually been even hand-holding people, and you and I have been doing that together now. And that hand-holding, above all, only giving them just a paper diet or a paper program, is it really helps, and motivating them continuously is such an important thing as well. So that really, in fact, brings us to the next important question is, if how does this condition really get diagnosed? What are the different
Yeah,
methods that you are
usually
following?
the commonest way in which women come for being diagnosed is that present with various issues. The commonest presentation is abnormal uterine bleeding or irregular menstrual cycle, or the menstrual cycle which has become, is not coming on time, or she's having reduced menses. So this is usually the complaint with which they would come to us, or they would come to us when they have not been able to get pregnant after they've got married and they're planning to have babies, but then the conception is not coming by. And that is usually, these are the two commonest ones when the patients are diagnosed. Very rarely there will be an incidental finding because they've come for something else and then we diagnose that they are having such an issue. Now, irregular cycles, I sometimes really tell my patients, you are so lucky that you have menses, because at least we are able to identify the metabolic and the endocrinological changes much earlier in women than men. So that, because they give us this opportunity to look at. So this is the presentation. And once a sonography is done, today if you look at all the international guidelines, we are heavily depending upon two important features. And one feature is the typical sonographic picture of the polycystic ovary, which is very, very typical. And the doctor has to analyze it correctly at the correct time in the menstrual cycle. It has to be done at the right time. And if it's done at a different time, you need to interpret it correctly. And the second one is looking at signs of androgenism. Now, what is androgenism? Is various kinds of pigmentations, or if you have, some sort of hair, facial hair, body hair, which is very, very non-feminine like hair. So that kind of hair representation, any other sign of androgenization for that matter, is a sort of a clue that this probably is PCOD. Of course, it has to be differentiated from so many other abnormalities. There are many other abnormalities which can confuse or confound this diagnosis, but as of this is the a general broad guideline that I must share with you. Yeah.
Sure. So, I mean, it is something which needs an attention of a real expert gynecologist so that she identifies the right signs for you and gives you the right guidance, which is actually most important when you're diagnosed with this condition. And she will actually be able to diagnose it even more than the typical scientific methods that we have. And if you've been with her for a longer time, she exactly knows who you are and how things are with you. So she can help always better analyze your condition. So also, ma'am, what are the really? I mean, we did speak about all these different metabolic disorders that can happen, because PCOS can really encompass from puberty up till you really having a menopause. So what are the metabolic disorders that are normally associated with PCOS?
The commonest metabolic disorder that is associated with PCOS is the insulin resistance. Very common. Even if it is a obese PCOS or even if it is a lean PCOS, both of them will have insulin resistance, and that will be of a different kind. They have a different kind, and that has to be analyzed and looked into. Because lean PCOS, even if they do not look fat, they still have insulin resistance. That is one. Second metabolic abnormality is dyslipidemia. Now, what happens with insulin resistance is, therefore, they have a fat accumulation tendency and a tendency of going into diabetes or a pre-diabetic condition. Dyslipidemia is when bad fats are more in your body. And when these bad fats are more in your body, that also causes disruption of your health in general. Usually, your cardiac health, your other cardiovascular health like hypertension and such kind of disorders can be associated. And the third disorder, which is actually confounding, is not a characteristic of PCOD, but many times it is found alongside there, and that is the thyroid disorder. Thyroid disorders are very common, and therefore I always like to target and find out whether they also have a concurrent thyroid disorder or whether they have anemia. Many times, even anemia, 70% of our Indian women are anemic, and that further adds, fuel to the fire. So these are various things that we have to look into very, very carefully. And of course, in a very severe case, or the case which is also having androgenic overview, can be having a chronic adrenal hyperplasia. And these are rare associations, but they can be, sometimes they have a lot of facial hair, or they have a very different kind of a body structure. Then those have to be analyzed with special tests. You are not audible.
In such a simple words, you really explained what that is, because I think this is again sometimes that we women have to face more than men on the other hand, but not a comparison, but it is something which we all really need to take care of. And metabolic disorders can be actually so many, and they have so much of high risk, like madam you explained. It can start from insulin resistance to going to abnormal cholesterol, heart disease, and can also give complications such as stroke or cancers. And sleep apnea and obesity are also diseases which are associated with them. So having said that, I think, ma'am, what are the real, I mean, then there are symptoms attached to it, especially the black pigmentation which occurs on the neck or other parts of the body. Is this something which is classic in PCOS? Does it occur to everyone?
Majority of them would have this black pigmentation. Nearly 80 to 90% of the affected people would have this black pigmentation, and it is a sign of insulin resistance, and also it's a sign of hyperandrogenism. Now the problem is, it is something to do with, there is one hormone by the name of melanocyte stimulating hormone. If you remember, in one of our last few series we had discussed a lot about
Yes,
when we are talking about sleep hygiene. And
correct.
this melanocyte stimulating hormone is something which is actually important for maintaining the proper sleep hygiene and your sleep cycles, apart from your skin turgor and so many things. So whenever you go in the sun, then that this hormone will be there in large quantities. Likewise, if you remain awake for a long time, you're stressed out, you're not following the circadian rhythm correctly, this melanocytes stimulating hormone will having a dominant kind of a work to do. And it is very important that it is secreted in a proper way to maintain your ovarian hygiene, your ovarian health. Now many times, and this hormone is important because it will give you good sleep, it will give you good healthy ovary, but this is the hormone which gets challenged many a times, and therefore these kind of things would occur. In any kind of a pigmentation on the body, I always like to diagnose it as insulin resistance and look into it. Now unfortunately there are not very reliable tests which have been seen the test of time to diagnose insulin resistance. So it is to be done by your clinical assessment mostly, and therefore we require to look into it. And if you identify it early and start working on it, and that is where your role comes in, because I am very curious to know from you as to if there is insulin resistance, which I tell you, like I tell you,
Yeah.
this patient has a very high insulin resistance. What would be your approach to that patient? Because that is very important. I want to understand from you that I try to do whatever I understand, little bit of I have done a lot of nutritional understanding and studies, but still,
Yes, absolutely.
from an expert like you, I want to know, how do you tackle this particular issue of insulin resistance in these patients? So can we have something from you to listen here?
Sure. So I think a few points to add to what you did say about the metabolic conditions that I also mentioned, that, up till stroke is something that can happen with this. But what I also observe in these days in patients is that, there is this new modern living syndrome. And I think this is so much attached with the PCOS syndrome, is that there's a chronic fatigue syndrome. So so many women feel a tiredness, fatigue, and at the same time, they are obese, and they're always anxious. They're depressed about so many things. If the fact that they're not able to get pregnant, or young girls who are trying to study, and then PCOS is a condition which they typically suffer with. A lot of association of anxiety and depression really is seen with it. And I find, of course, the insulin resistance is there, but there are all these underlying factors which are really contributing to something which creates this hormonal imbalance in our body. A lot of inflammation that I feel is a major cause for this. So, the important points that I really like to focus when I am trying to give a diet or a proper nutrition plan, I would say, to these patients is, of course, reversing the insulin resistance, but along with it, losing weight is extremely important. Trying to give different foods which will help balance these hormones and lower the androgen levels, lower the inflammation in the body, and improve the basically the mood, and improve energy. What really happens is everyone is trying to lower the carbs. So of course, when you say typically how do you handle insulin resistance, it's the carbs. So you have to work on lowering carbs, and it has been observed that if you lower carbs, hike your proteins, also start hiking the good fats that you're giving, this can actually help address this. Again, fats are not bad. If you're able to manage the good fats, they are going to really indirectly help in the process of reducing inflammation and also the insulin resistance. So I have observed that, of course, carb counting is one thing, but really trying to, eat carbs which have lower GI absolutely helps in the process of, you know, actually managing PCOS, and we've observed that it gives incredible results. But along with it, we have to make sure that the nutrition that we're eating gets digested well, keep our inflammation lower by eating, these low, which diets which are anti-inflammatory foods, and also keeping our energy levels high. So these really are the areas which I focus on. And of course, something which women never focus on is the fitness regimen. So anything we are eating has to be also balanced out with at least 30% focus on fitness, which we don't do. And something which is your favorite, ma'am, that is sleep hygiene. So it's the triangle, right? That we have to have diet, nutrition, and good amount of sleep. And thanks to you that we absolutely dedicated one session on sleep hygiene, and how many of us really realize. So it's all the chronic fatigue syndrome which I associated with, because you have depression, anxiety, we have nutrition issues, we don't digest well, and that affects our sleep as well. And then it's going to keep us under this continuous fatigue, which I think has a good amount of implication on PCOS. So that was really
Would like to
in.
add something to this,
Yes,
Rajashree.
sure,
What
yes,
I would look at also is one, is that their composition of every time meal has to be proper,
yes,
where they should
yes,
take a lot of proteins and fibers. That is one thing which I stress upon, as you
yes,
rightly said. And the
absolutely,
second thing is, my stress is lots on taking green leafy vegetables, salads in very humongous quantity. Like, I believe in it
yeah,
that they must take it in huge quantities. So maybe
yes,
you take it through smoothie or soups or whatever, but that definitely would help, is what is my call on that. Because as you rightly said, inflammatory process requires to be looked into,
yeah,
and we cannot keep them hungry. Most of them are fasting, and if you keep them hungry, they're already overweight, they're already sort of undernourished.
yeah.
Undernourished makes it they're malnourished, is what I would like to
Correct,
say. And
absolutely
on
right,
that,
absolutely right.
if you feed them and they're hungry, they're tired, they're bored, they're not interested in whatever diet plans you give them. So
Yes.
you must feed them, but you must feed them correctly, should be the principle. Yeah.
Like you said correctly, and they need to get a good understanding of what they're eating, because at times, of course, vegetables and fruits and the raw stuff you're talking about, people don't eat, and
Yeah,
it's not in a regimen in our culture
they
at all.
say
So
that it is expensive, it is inaccessible, then they have reasons that there are fertilizers, then they're unclean, and they're such a bother.
So there are simple methods. Again, you have to peel them, you can half cook them, but that also has to be like, absolutely to your point, that they have, the boredom should not set in. So how they are going to be able to manage it? And there are so many simple techniques that you can energize. First of all, you need to energize your mind and get into the mode of doing it. So rightly pointed out, madam. And then we will of course talk a little bit more about nutrition further down. But what we are observing right now is PCOS is on a humongous rise. And of course, one, because now we are able to identify it, we are able to diagnose it better. Earlier, probably we were not able to do it. But is there also a significant rise in this condition? And like you said, this shouldn't be actually measured as a disease. But have you seen this condition going a little bit higher these days, especially?
Yes, it is going on the rise, and the rise is going on because of, again, a serious lifestyle change and all these environmental issues. While you were narrating all the environmental issues, one of the most important things that you did not mention was stress. I do
Yeah,
not understand what kind of stress is getting, they are affected, because probably the society is being brought up in a very sheltered atmosphere,
yeah,
and that is adding to this kind of a stress like situation. Even small issues give them a huge setback. And I
totally.
remember that whenever we study about the sort of the regulation of the menstrual cycle, there is a huge role played by the hypothalamus, which is the the leading center in the brain, which sort of regularize the entire hormonal system in our body. And if you are worried, if you are anxious, if you are stressed out, these hypothalamic signals to the pituitary gland are going to go abnormal. And that is the reason why we see these things, because all these years while I was getting trained in OBGYN and I was training my students, we used to give very less credentials to this hypothalamic situation because we felt that life comes and we accept it as it comes. But today
Yeah.
I'm seeing that that is a huge lack. And that is the reason why it is so much on the rise. The food access has changed. Previously we used to not have access to any junk food so easily. Today you just have to dial any food thing and they will come home with whatever you want. And that also is a reason, because I'm always worried about the condiments, the oils that are used in the foods that are sourced from outside. If you remember, last time we spoke about pan as a mnemonic, wherein you need to cook your own food. If you remember, I have
Yes,
spoken
of course.
in my own interview.
Yes.
And that is the reason why it is rising, because working hours are terrible. There is no time or place for exercise. And food is also not, balanced correctly, and too much of stress. I think that is the reason why we are having problem.
Totally. So I think absolutely to the same point, and there's this constant fatigue which I mentioned, and stress is the major reason behind this syndrome. So we may name it differently, but in case of women, if we have a chronic fatigue syndrome, which is more common, it is really around PCOS, which I was mentioning, and so also we are seeing this on a humongous rise. I mean, I have also been talking to many of these young women, and we see that every 1 in 3, at least I have observed, are having some of the other issue around their periods, and it is really boiling down to something which some of them manage early in their lives, but some of them are not able to, and it becomes a very difficult condition. So really, why do ovaries become polycystic? Because again to make it more simple for people to understand, why are these ovaries, what do you mean by ovaries becoming polycystic?
See, they are supposed to be having a specific volume and a specific size and a characteristic, but they become swollen up. They become polycystic means they become swollen up. They become swollen up because there are those small follicles which have not ruptured, and they form those blebs full of water still there, studding the entire ovary. That is one. The second thing is that ovary has a central core part which is called as the stroma, and that stroma is very sensitive to those androgenic hormones. So if there is androgenic hormone, that stroma also swells up. And there is an inflammatory inner ovarian inflammatory process, because of all these kind of things that we discussed just now, that inflammation causes the ovary to swell up. And the fourth reason is, today we are identifying that many women who have polycystic ovarian disease also are having endometriosis along with that.
Yes.
Endometriosis is another disorder which is exaggerated by abnormal lifestyle. And that is wherein the ovary becomes swollen up. So there are various reasons why your ovary will become a polycystic ovary. And structural change, just imagine that there was just a functional change in the beginning, but now it landed you into getting into a structural change. So you must understand that how much reversal you will have to go into to make a lifestyle change, because many PCOS patients keep on hopping from one doctor to the other, to the other, to the other, using one diet plan to other medicines to other. You'll have to have patience, because
Yeah.
it took a longer time for that ovary to become like that. So it's going to take that much time to go in back in for reversal. So you will have to have patience and a dedicated, perseverant approach. Without
Yeah.
that, you will not be able to achieve what you want to.
Absolutely. And there, I think, I would like to emphasize again a little bit of on our lifestyle, because what is happening with this increase in numbers, and this has now become very fashionable. So I think, and ma'am, I don't know if how many of your patients do that to you, but people want to follow all these new fashionable diets that are there, and they read about it, and they feel they're really going to help them. What's your observation on that? Because people keep asking me if they're these days, at least people have started asking if will that help me? Can I continue doing it? I was told by this by this trainer that I should continue, use this diet. And because I have seen a lot of detrimental results there, but
Effects, yeah. See,
yeah,
I will just tell you one thing, that every person is unique, and every person requires a unique tailor-made formula.
yeah,
You cannot put the same formula to everybody. That's one.
right,
Secondly, there should not be malnutrition or starvation or deprivation of food, which happens very, very commonly in many of these diets. You have to have that there are specific ways in which your diet is going to get assimilated, and that has to be followed. And I feel there is something called as a ritual. Food has to be a very important ritual which is to be persistently followed. So you
yes,
will have to identify what it is and what is going to work for you, because I'll tell you, constantly shifting from diets to diets also can change your intestinal flora, and that intestinal flora is very important in metabolic
correct,
understanding. So you have to understand, and everybody is unique, everybody has his
yeah,
unique formula. For example, if you tomorrow tell me, madam, you need to take green tea, I can't tolerate that green tea, I can't even take it. So probably
yeah,
I have some issues with the green tea. So
yes,
everybody has to understand that there are the various things, so nothing
yes.
will work, and therefore you have to have a proper structure. I hope I answered you
Yeah, yeah, and to
correctly,
add
because
to
being a
add
nutrition expert, yeah.
Well, totally, I agree with you, and to just to add to what you said, and it's very similar that I'm going to say. You said that it should be a ritual. I keep saying that because now people are switching from diet to diet. I have connotated diet to be a fad, and I think diet is something which we should really not follow. We should make nutrition as an attitude, and it should not be only our attitude. It should become a family attitude. So it becomes like a ritual exactly. So I totally advocate the fact that nutrition should become a family attitude. At the same time, we have to realize that we see that, like Madam just mentioned, also, I totally agree with the fact, that three things need to be majorly done. GI health is another issue where your enzymes and also the good bacteria that are there in your gut. These are extremely important because whatever you may eat, if it doesn't get assimilated well, and stress and less amount of sleep, anxiety, depression actually sets us into this. So no matter if you get a good diet, if that doesn't get absorbed well, and if there are no good bacteria in your intestine, all this actually disrupts your mechanism. And so really these three important ingredients, I would say, one is protein, and proteins really are very, very important because and then they have to be digested well with good amount of enzymes. So if proper digestion of proteins happen, protein are actually giving amino acids, which really are components for making the hormones in our body, which are important to make the enzymes in our body. So enzymes and hormones to me are the most critically important ingredients in our body. So if these two are balanced well, for that we need to be eating good amount of proteins, and at the same time good fats are really important because they also can help us keep the inflammation lower in the body. So from me, an ideal nutrition plan should really focus on anti-inflammatory foods, carbohydrate control, of course, and not to eat refined sugars, keeping low glycemic index of our foods. Eat nutrients that will give us, give us good energy. Fibers have to be eaten in good amount. Again, fibers, not all types of fibers. Eating fibers wisely is important. Otherwise, they will again set you into a fatigue or depression, and you will just not let you continue with your plans. So a proper balance again with proteins, healthy fats, and fermented foods, which can give you the probiotics, is extremely important. I always emphasize on the importance of enzymes because they help us uptake all the essential nutrients that we're eating, right from vitamins to helping us uptake the immunity nutrients also, which are very important today. And like ma'am said, absolutely important that we should have an integrated plan, which is integrated firstly with your gynecologist who's treating you and how she's been treating you, your history, and along with it, a good nutrition and a fitness plan. So that's really an important thing, and it has to be personalized. It cannot be one size fits all. So That really also brings us to the question about the risks and the complications that PCOS can give us early on and through the years of fertility and then going over to menopause. Because at times you've seen that menopause also gets delayed with PCOS. So, I mean, we would love to learn that from you as well. Oh, you need to unmute yourself.
PCOS is a disease which is affecting the ovary. Having said that, ovary is at the core of the woman's existence and womanhood. And firstly, it would just start off with abnormal uterine bleeding or inability to get pregnant. But then it can cause a whole lot of complications even during pregnancy. Like there can be miscarriages, there can be preterm deliveries, there can be abnormalities in the baby. The mother at risk of developing blood pressure complications and diabetes are very, very rampant. What is really tragic is they also land up in a residual obesity post delivery, which doesn't come back to normal at all. They continue to have that obesity. So a woman who would be just pre-pregnancy about 55 kgs, she becomes obese during the pregnancy, and then she comes back after 3 years of the delivery with 85, 90 kgs of weight. And this is because of the fact that probably the proper guidance was not there, and this PCOD kind of a situation became very, very compounded in that woman's body. That was one. Secondly, the residual obesity itself can cause you problems. So you're at risk of developing diabetes, hypertension, cardiomyopathies, because these women then are similar to men at the same risk, because there's a lot of weight which the heart has to pump blood into, and that can cause problems. There can be slip disc, there can be a lot of bone issues which are associated because the bone structure cannot carry so much of weight. And as far as the hormonal abnormalities are concerned, if you look at the possibility, if the women are constantly having irregular cycles on and off, they are at risk of developing endometrial and ovarian cancers. Now, endometrium is lining of the uterus, and ovary is the ovary that we are talking about. So cancers of these things are on the rise now, and they would occur a little earlier than they probably decade. So normally when we see that cancer of the endometrium occurs in the fifth decade of the life, or the ovarian cancer usually occurs in the fifth or the sixth decade of the life. In a patient who has PCOS and abnormal uterine bleeding associated, these will have the possibilities of developing these diseases a little earlier, maybe in the fourth decade of life itself. And therefore, and plus it gets further compounded by if you are a smoker, or if you have, and especially if you have had to take a lot of medicines to get pregnant, ovulation stimulation drugs and all. There's a huge lot of movement across the world which is identifying that this ovulation stimulating drugs also can predispose to some very difficult types of cancers that are now seen of the ovary, and they are very, very sort of violent cancers. They are having a supra malignant potential. So these kinds of things are there because there's something going wrong, definitely.
So coming back to your point, really, I mean, what we are seeing that initially you mentioned that this shouldn't even be considered to be a major syndrome or a disease. So something which is very, very simple and can be, diagnosed early in life and be treated well early in life. If that is being done and if our lifestyle is kept proper, we can be saved from such bad complications. I mean, we started speaking from a simple thing to going to such grave complications. So what is your normal advice to your patients when it really comes to treating the disease? And I know that you emphasize on the fact that this should be given a very early attention and this should be taken care of in a very disciplined way.
Yes, you were saying something, Rajashree? Yeah.
So I did mention that you keep emphasizing on this being a very simple condition, but from there it really is going to such a graver complication. So I mean, how do you really treat these patients, from a
See,
perspective
when
that,
they're very young, you cannot talk to them
yes,
about the futuristic kind of complications. You have to just
right.
tell them that it is very important that you remain healthy, that you look good, that you have a good capacity. It's not about looking good, but it is also about physical exercise, physical fitness. And because I'll tell you, these hormonal changes are causing a lot of mental disorders also, because they affect your thinking pattern. Woman's thinking pattern is determined by her estrogen, progesterone also. So all these can get affected. Plus, if they put on weight, have pigmentation, they have irregular cycles, then they have unfortunately a very poor body image. Then they can't concentrate on their work, studies, and so many other things. So many times it's not fertility as an issue or even menstrual cycle as an issue. They have just come that as an anxiety part. But we have to go behind and beyond all this and analyze and try to help them. And I also, as I always mention in all our talks, I always base my strategy on ahar, vihar, and vichar. What diet you are taking, what are your general practices of living life, and what is your physical activity. So yeah, these three sort of angles of a triangle are very important for me to be able to analyze the patient correctly and offer her care. And when I have found that the patients have fallen in this strategy, have accepted me as their clinician, and they have trusted me, most of them have had wonderful results. And that is the reason why these things matter. When they become older, even when they are planning to get pregnant, I would rather first optimize their general health before they embark upon pregnancy. Immediately, I wouldn't start them on ovulation induction medicines. And for me, it is not only the woman's health, because that's also a reflection of the health of the entire family. So we have to also see what her husband is doing. Maybe the husband is also taking the same kind of, he's in the same environment, the same kind of diet, same kind of nutrition, and same kind
Yes.
of stress levels even he must be undergoing. So this required, because finally parenthood is all about creating a healthy baby and a healthy future society, as I always say. So that optimization is important. And if a woman has come at a later date, then of course I will put them through a judicious and a rational screening for metabolic abnormalities and cancers, and guide them about regular surveillance, and trying to inculcate healthy habits and guide them about those things. And we have to keep on switching for alternatives. Sometimes you may not be able to have an idealistic sort of a compliance expected from a patient. Then you will have to give them a sort of tailor made kind of an things which can help them to overcome this malady and understand these things better. It's very easy for us to say ki gym karo, exercise karo, ye khao, wo khao, but not all of them would be able to do that. Because as you understand, I cater to not only patients who come from a high affluent class of the society, but I also have patients who come from the low middle class kind of an
Yes.
access, where I have to tailor made these treatments, because I also practice in a university medical college, where we have to understand everybody's backgrounds and then offer them treatments.
Totally, and I love the fact that you said that it should be something which should be a family approach. I mean, it's affecting everyone in the
Absolutely.
in different ways, and like most of our diets and a lot of patients that we have been treating, we have had different patients, and I think we will go on to discuss that. I'm just going to emphasize on a few points where people keep asking about what are the different types of nutritional supplements that they could try, and I know you've been utilizing, and I will ask you to comment on it, but few of them that I really want to point them out is one of them, which is myoinositol and d-chiroinositol. Normally those are given individually or in a combination. Zinc has been observed to be very of a very good help, as it helps with symptoms, especially in ovulation, acne, weight management. It has given positive results. Curcumin, which is of course a part of turmeric, has a very good anti-inflammatory and antidepressant effect. Fish oil and flaxseed oil, which I was talking about, good oils, the omega-3, which is the EPA, DHA, and the phytoestrogens that you can get from them can really aid in regularizing periods. They have a solid anti-inflammatory and antioxidant effect, which can help reduce testosterone levels in those with PCOS. So such ingredients are primarily very, very helpful. They can help improve mood and anxiety as well. I emphasize on taking multivitamins, but with with proper minerals, electrolytes, and antioxidants. All of this, if it's taken together through foods and also when needed from supplements, because they help us stay hydrated, because this is another problem with women: staying hydrated, staying energized. Eating well doesn't really fall in our whole regimen. We are running around our house, or if we are working, we're also running around our professional commitments, and we forget to hydrate and energize ourselves and keep ourselves complemented with these vitamin insufficiencies that we have. So, like Madam emphasized on the fact of stress, vitamins can, there are de-stressed vitamins which include A, B, C, E, and of course D has to be consumed because we do see a loss of minerals, especially like calcium, and in these conditions. Also, I have emphasized on enzymes, but also herbs like ashwagandha has actually been observed to be very useful in bringing down anxiety and stress, and has positive effect in PCOS. And this is an herb, now everyone's really going for it because of its immunity profile that people are finding it useful. And also melatonin, which Madam did also mention the condition, and she's of course emphasized that, and I also support that, that melatonin and more such supplements can help us aid in good sleep and with its antioxidant effect. So this all can really be very useful. Ma'am, if there are any inputs you want to also emphasize on, because I know you've been using a lot of chiroinositol and dechiroinositol in your patients. So what effects you've seen with some of these supplements?
I would actually agree to what you are saying, Rajashree. Is, most of the medicines which you mentioned are not only full of nutrients, but also are having huge anti-inflammatory properties, according to me. And therefore, it's not only about taking medicines and treatment for the hormonal abnormalities and insulin resistance. I would always rate that in the patient's entire treatment conglomerate, nearly 50% of the contribution comes from the right diet. So it is the right diet that she takes. 20% more, maybe 20% would be about what the doctor gives as medicines, but the large role will be taken by the patient herself, where she is modifying all the different issues which are very important.
Superb. So I think, I think this really is a holistic or integrative treatment that you believe in. I think if you can emphasize on that, especially if you could give us some of your real life examples, because I know people keep asking. There are these mothers of young girls who always keep having issues, and at the same time so many of them have issues when it comes to fertility and when it comes to second pregnancies also. So if you could share some of these
So,
examples.
yeah, I'm going to give you two important examples. One was about a young woman who got pregnant, got married at a very young age. At the age of 19, she got married. And then she conceived within 6 to 7 months of that marriage. And she carried this pregnancy forwards. And then she delivered. And after delivery, throughout the entire pregnancy, if you all understand that it is very important that we put on only about 11 to 12 kgs of weight throughout the entire pregnancy, but she had put on something to the tune of 22 to 24 kgs of weight through the entire pregnancy. She also had diabetes. Just imagine, at such a young age she started developing blood pressure at the end of her pregnancy, a rise in blood pressure, and she also had hypothyroidism entire pregnancy. Now she had to take medicines for that. She was staying in a place where she could not go for walks or do any kind of exercises. And then the access of food was typically what the family would make, wherein if you realize that most of our foods, especially in the periphery, is usually a carbohydrate based diet. A lot of carbs are consumed and very little kind of vegetables or fruits they would take. It's more about carbohydrates, and that was what was food intake was. She landed in a cesarean section because there was rise in the blood pressure, the baby's heart wavered during labor, and a nice healthy baby was born to her. But then after delivery, she put on another 10 kgs of weight. So you can imagine that she had in all put on 35 kgs of weight. And now she came to me after 4 years after that delivery, asking me, Doctor, I am not able to conceive now. Can you help me? So this woman now at this age was only 25. At the age of 25, she had no menstrual cycles. She had put on a lot of weight. She was at risk of diabetes, blood pressure, and she was also not able to get pregnant. The first thing that I did was I analyzed her entire story, looked at her diet recall, and I told her, please give yourself a time of 1 to 2 years because we are going to gradually lose weight. She embarked upon this healthy lifestyle journey along with my support, and every time she used to come regularly for me, we could get her rid of hypothyroidism. Absolutely. And secondly, while we were on treatment itself, she must have knocked off about 20 kgs of weight. And one day she came telling me, Doc, I'm already pregnant naturally. And we continued this pregnancy with entire hand holding throughout the pregnancy, and she is now doing very well. She keeps on connecting to me every 6 months, telling me that she's maintaining a good health. She has two lovely daughters now, and she's doing very well. The second patient was a patient who came to us who was a dancer, had an absolutely good, sort of a good sexual relationship. There was no problem. She used to ovulate and everything. But our ovaries always looked like polycystic ovaries. So I did certain hormonal tests, and it implied that she has had an abnormal ovarian influence for a very long period of time, and therefore we had to do certain surgical procedures to ensure that her ovary swelling is reduced. After reducing that ovarian swelling with little bit of stimulation, she became pregnant, and she carried that pregnancy very healthily. One of the important things which I had missed in asking her history was she used to consume about 15 to 20 cups of coffee per day. Now, why do you think women will take so much of coffee? That itself implies that she used to be fatigued, she used to be tired, and she must be under some stress to make herself, sort of get into that coffee. The first thing was to completely take that coffee out of her life. And after she went through that little surgical correction with lifestyle change within
Good
6 months, she again came to us with a natural conception, had a wonderful baby. At the end of the pregnancy, she did have a little diabetic kind of a situation, which was corrected, and she's gone well. The third incidence was a woman who presented with irregular bleeding. She had already had two children when she was a very young woman immediately after marriage. And now she had kept on getting irregular cycles, had put on a lot of weight. And when we saw that she had developed thickening of the endometrial lining, and she had a typical polycystic ovarian syndrome like the lifestyle change, certain hormonal corrections, and everything has been fine. So you have to believe in yourself, and you have to understand your doctor. Whenever the doctor tells you to lose weight or to change your diet, the first thing the patient feels is, to doctor hai ya nutritionist hai, tu mujhe ye kyun bata rahi hai? But then, as I mentioned, that is a very important part of the treatment. And not only that, I also like to take their stress, kind of stress indices. I have my own ways of assessing them, and that helps in a much bigger way. Another challenge, which is Rajashree, nowadays I'm seeing very young girls, just to prevent an unwanted pregnancy, are consuming a lot of hormonal tablets, especially the after pills and such kind of emergency contraceptive pills. And I feel these very high dose of hormones also act as disruptors. I'm completely against smoking, undue consumption of hormones, junk food, taking too much of sugar. All these things are not nice. And you must have a routine physical activity. There is no excuse for doing an exercise. The moment they become pregnant, then they will come saying, Doctor, I'm having a backache. Now, is there any reason why that small little pregnancy will cause you a backache? That means your muscle doesn't have any strength. You've never done any exercise. So naturally, you're going to have these problems. And the third thing is anxiety. Abhi on routine, if you ask my nurses here, when we are measuring pulse of a patient, एक भी patient का pulse 100 के नीचे नहीं. All of them are having 110, 120, 130. इतना क्या anxiety है सबको? we require to really look into getting pregnant is not a high risk factor. Yeah, it's a wonderful experience, and let's make it wonderful. Because unless and until you approach it, as a wonderful blessing, as a, it's a certification of you being healthy or having a possibility of being healthy. It's our bound duty to maintain it that way and take care properly.
So I want to really add on this very important point that you made, that instead of being a very pleasurable, happy experience, women are so anxious, and a lot relates to the fact that there is lack of education, lack of understanding of all these conditions, complications, and of course a lack of a very good gynecologist, and probably a supporting nutrition team to really tell them confidently, and whom they trust so much, to actually overcome this problem. And it's such a pleasurable journey to actually be a mother, or a pleasurable journey to be a woman itself. So if we get the right guidance, and the whole idea behind these programs really is to understand these difficult conditions well, so that you can actually have a good regimen in terms of what to be, what should be your lifestyle, what are the mistakes that are happening, if there are any mechanical issues which need surgical attention, or they need a treatment attention, or majorly also trying to follow a good nutrition path, so that with a good discipline, if we are able to do all of this and incorporate all the good regimens of fitness as well, it can be much easier. But really, I think, ma'am, it is very pivotal to understand these different conditions, the complications that can arise from there, and what are the right methodologies that really we need to be understood. And I think all of this we can say because we've gotten over our own womanhood, and motherhood, and we've also faced all these challenges. But having the right practitioners, and having the right OBGYN really at that point in time is extremely important. I am saying this not because we are doing this program especially with Dr. Wagh, but it is really blessing to have a doctor like her, who understands so many conditions intrinsically, and when she is being patient and trying to guide you also with lifestyle and nutrition, and when we as a team are trying to do that, it is really for making this a very healthy and happy journey for you. And we will continue doing this, ma'am. I think we really had a very I would say a total session, beginning from understanding this condition to how to treat it, diagnose it first of all, and what are the different complications that it can bring about, and a complete holistic management of this condition. We have to keep relentlessly doing this, and I hope the viewers who are always encouraging us by coming and attending this need to spread this awareness, help us spread the awareness, because we are not trying to do any commercial activity here by spending those additional 1, 2, and actually more hours preparing for these sessions and bringing them to you, so that we can spread more awareness about this. Last time's session, Madam really shared her own life story with us, and how she's relentlessly been working on educating women through her association, organization, these activities that she's been relentlessly doing as well. Thank you, ma'am, for taking this up for we women, really. And it's a selfless activity that you are doing, and I'm happy that I'm able to support it, and you are also supporting my initiative of this, taking this education relentlessly forward. And on that note, I think we can end this session with a few words from you.
Thank you so much, Rajashree. First and foremost, I must thank you for these wonderful opportunities that you give me to share my experiences with the entire community, because that is my purpose of existence. Every time a woman comes to me with an early pregnancy or wanting to get pregnant or having any problems, I go through that childbearing and rearing kind of an experience all over again so many times. And it is wonderful journey as an OBGYN specialist. I feel I'm contributing to the society by giving them healthy babies. and by helping these young girls and women to be healthier in their life. And therefore, this is something that I want to do always, and I love to share whatever I have. And thank you so much for doing that. I only want to say that be confident, be brave, be smart, and be very, very positive, because it's only a fluke of the evolution that you get an opportunity to become a woman. And if you ask me, if I get an opportunity to become a human being once again in the life cycle, I would always want to become a woman, and I will always want to become a gynecologist like I am just now.
Wow, that's great. Well, so on that sweet note, viewers, we'll say goodbye to you for today or for today's session. We, of course, will be back next Wednesday with our Woman for Wednesday with Dr. Wagh, which we love coming to you and presenting newer facts and ways to manage your conditions. Goodbye on your note. On this note, see you soon.
See you soon. Bye bye. Are we off? Off?